Hello, guys. Good evening. Today, we would be talking on orientation in medical gastroenterology. Now, we have a special situation here where we had NEET SS 2021 actually happening in 2022, early part of it. And we will be having NEET SS again now. So, what I would want to tell you guys is, um, it would hardly be there in few months in June. So similar time, we also have INISS also. So with the change in pattern of NEET SS, with predominant questions being from overall feeder branches, and for NEET SS, we have the standard old pattern where you have almost 80% of the question from the major branch and 20% from medicine, statistics, etc. So students are really confused on how to go about it. So I have from doc tutorials, we are planning to have a parallel session for both of them, and in a way help students who are preparing for both. So first, like I have already explained, Dr. Rahul sir from neurology and medicine have already given a detailed schedule for those who are preparing in the medical group, which includes a schedule which starts with neurology, then cardio, then we have nephro, then gastro, and then oncology, etc. So here, I would like to say that for students, there are a few important things to know. People who are predominantly preparing for NEET SS, if they go according to this particular sessions and prepare accordingly, that should suffice. And for those who are preparing for INISS for a particular subject, they can allot a specific little more time to the standard books or the reference books that they are going through. And from gastroenterology perspective, Schlesinger should do a good job with respect to preparation. So as of now, just to tell you what are the topics that are important for the two test series that has been held as a part of NEET SS season, Elite Season 2. So part 1, we have divided as gastroenterology, and part 2 as hepatology. Now, gastroenterology, I would want you guys to concentrate on these topics so that we'll have an overall cover. One, the nutrition, which includes also obesity, esophagus and its disorders, stomach, small bowel and large bowel. And large bowel should include also the anorectal region and pancreas. GI oncology with pancreatic cancer is also quite important topic. So please go through them. And endoscopy, special techniques with respect to endoscopy, and some investigations are all the questions that would be asked in part 1. Now, in part 2, hepatology, these are the topics that has to be concentrated to have an overall idea what would be happening. First would be anatomy and physiology of liver, which has been quite detailedly and well explained in Schlesinger first chapter. Then acute hepatitis, ACLF, and ALF. These three, ACLF is a newer topic, so questions are being asked in this particular topic. Then we have chronic hepatitis, alcoholic liver disease and NAFL, cirrhosis and its complications, and including HCC, liver transplantation, and diseases of gallbladder and bile duct. If you're able to divide the topics this way, that would be really beneficial in completing majority of the topics that has been asked and will be asked in NEET SS from gastroenterology and hepatology perspective. So now how to combine both the preparation. So when we went through it, I feel that each week when you're going through, like say, neurology, then cardio, then nephrology, and then gastro, hepatology, oncology, you go through that particular week at least 4 days on that particular specific topic, and rest of the 3 to 4 days in you should be able to allot for your standard reference books like Schlesinger. So the pattern of going through which might help you the most would be first going through the videos of each of the consultants who have explained them, making it quite short from Harrison. And then you can go through the text or review. When you're going through Schlesinger, it may not be necessary to go through all the topics as of now, but for INISS, it may be necessary. Next few slides, I will be telling you guys what may be important chapters to go through so that the impact of your reading is quite well established. So I would want you guys to also mix up reading Harrison, Schlesinger tables, charts, pictures, and if possible, review questions. There is a separate session after each of the elite series where you have the sessions being discussed. Please go through that. And then you have question banks with also past recall sessions. Go through them. This should be top up by finally towards the end of the exam. Grant test will help you assess detailedly. And by then we will be coming up based on each subject about high yield points to make it more clear. And with respect to INISS, for those who have got selected for level 1, for level 2, we also have interview sessions and mock sessions to help you to get drilled for the exam pattern. So this is the overall thing that has been planned for the exam. So I hope this way of reading would make it clear for you guys. And with respect to reference book, I would, from gastroenterology perspective, we follow Schlesinger. So from Schlesinger, I would want you guys to go through chapter wise so that there is no, randomness when you go through at least. Then please read smartly, that is spend more time in high yield topics, and tables and figures are really high yield. So do not miss out on them. If you have any doubts or recent guidelines is there which you want to know, the UpToDate has been a good source as per students and also from personal experience for with respect to solving some questions. But the recent guidelines, I would suggest you guys to be away from it, because in the classes, we would be explaining what's the most recent in this. At this juncture, I would like to tell you that ISG, that is Indian Society of Gastroenterology, in their Facebook page or in YouTube, you have a lot of videos on few important topics where the experts of that particular subtopics have actually spoken about them detailedly. So that will give an extra edge, and that's especially for INISS and interview rounds, they also may play a role. So some of the students had asked me, sir, Schlesinger is too vast to read. Could you just tell the high yield chapters so that if you at least go through that in first round, we would have an edge, at least 70% to 80% of the questions would be covered. So these are the topics that I have jotted down based on the previous year questions with respect to its importance. With respect to gastroenterology per se, these are the topics which are important. Chapter 3, that is microbiota. Chapter 7, obesity. Chapter 20, gastrointestinal bleeding. Chapter 23, factitious gastrointestinal disease, which predominantly includes the functional types. Chapter 28, which includes caustic ingestion and foreign bodies and bezoars. Chapter 30, eosinophilic disorders of GI tract. Then chapter 31, protein losing gastroenteropathy. Then you also have chapter 32, gastrointestinal lymphomas, where especially CD markers and few questions can be asked in the general exam also. 33, GIST has been asked quite frequently, so that is also an important chapter. Chapter 34, neuroendocrine tumor, a very important chapter. Chapter 40, GI and hepatic disorders of in a pregnant patient is also really important. Chapter 45, esophageal disorders caused by medications, trauma and infections are asked. Then GERD, esophageal tumors are important topics. With respect to stomach, chapter 52, gastritis and gastropathy, peptic ulcer disease and adenocarcinomas are really important topics. Then with respect to pancreas, acute pancreatitis, chronic pancreatitis and pancreatic carcinomas are important topics. Then gallbladder disease chapter is important, followed by primary and secondary sclerosing cholangitis. Then the GB cancer is an important topic. Then comes directly chapter number 4, maldigestion, malabsorption. 105, many questions are asked on this topic. SIBO. 107, chapter celiac disease, a few questions can come up. 108, Tropical diarrhea is important. 112 is really important with respect to questions. Go through the algorithms with respect to antibiotics and Clostridioides difficile infections. Then 115 and 116 chapter is on IBD, and both of them are really important with respect to knowing few drugs and management of moderate, mild, and so classifications are important. Irritable bowel syndrome is a good chapter, and questions will be asked in that. 25 tumors of small bowel, better to cover it. Maybe asked 126, 127, that is polyps and cancer are important topics to be read. So this covers the entire topic from gastroenterology perspective. Coming to hepatology, there are fewer topics, but yield is much higher when we look at hepatology. That is why many of the students, if they ask gastro or hepat, which shall I start reading? Hepat may be easy because at least half the topics you would have already covered. First is the chapter on embryology, anatomy, histology, and development of liver. Really important chapter, but a small chapter, but a high yield. Then comes cirrhosis and its complications. Complications has been compiled as different chapters, as chapter 92 to 94. Please go through them. Hemochromatosis, Wilson's disease are important again with respect to few question biomarkers. Then comes hepatitis A, B, C, D, and E. Go through them. The treatment algorithms, especially for B and C, are important. Then chapter 86 and 87, that is alcoholic liver disease and NAFLD, are important. And then 90 and 91, that is AIH and PBC, are important topics. ALF, tumors, and liver transplant are the last few topics, and they are really important. But what I would want you to add on is ACLF, which is an upcoming topic, which are there in recent books of parallel other textbooks, are important topics. You might jot down some things from the definitions and things like that, because all these topics has been chosen based on the questions that has been asked recently. So guys, if you're going through the standard textbooks, please go through all these topics in some order. With respect to INI, SS, the parallel elite sessions which we will be coming up will also be probably in this particular pattern. So hope this orientation session helped you to some extent. What I would want you to tell is, more than reading too much, it is smart reading, which will be really important at this juncture with the time that is available and with the vastness that has to be completed, especially when the feeder subject is a complete medicine based. So thank you. Thank you for the opportunity. Let's see soon to meet you all in live sessions and recall sessions and question discussions and high yield points. So thank you. If any of you have any questions, please put up in the chat box. Okay, no problem. If there are any questions, please, there's a separate WhatsApp group and a Telegram group also, or you have other strategies which need some revision. We are always there to help you. My telephone number is 740-664-8141, and my email ID would be prashanthbgandhi@gmail.com. So you can use either of them to contact me. We are always there to help you out as a team. Thank you and have a nice day.